CNN recently reported on shocking footage that shows an Indiana mother passed out in the front seat of her car outside of a dollar store parking lot, clutching a syringe as her infant child sits crying in the back seat. Paramedics arrived on the scene soon after the footage was taken and were able to revive Miss Hurt using 2 doses of Narcan, a drug used to reverse the effects of opioids on the body. Erica Hurt, 26, has struggled with drug abuse since the age of 15 and began to seek help at the age of 21. Only 2 weeks prior to the overdose, Miss Hurt had been released from a month-long stint in rehab, and like many other drug addicts, she justified her use in the presence of her infant child by using excuses centered around the child's inability to understand what was happening. Since this video went viral, Miss Hurt has been striving to remain clean and was sentenced to 6 months of intense rehabilitation, which emphasized the importance of treating the underlying conditions that lead to addiction. Miss Hurt has managed to turn her life around since that day in the parking lot. She has been sober since the incident and works a full-time job at a local factory while also managing to care for her son, despite guardianship being granted to her mother. This is just another grim reminder of the opioid crisis facing the nation.
I'd only been home from rehab for 2 weeks, so I knew that I was making a bad choice. I was miserable and I was unhappy. So, I was driving home and I just knew that at some point I wanted to use because I didn't want to feel the pain that I was feeling. My son was asleep in his car seat and I used the justification that he's too young and he doesn't know what's going on if he does see me. When I first seen the photo, I was real humiliated. I was angry and I wanted to blame the police for, putting my business out there and, showing the world my private addiction and everything like that. But I'm thankful now that the cop did take the picture. The fact that I'm able to look back on that picture and see where the addiction had taken me, and I'm able to use that picture now to show others that addicts can recover. Before, when I have always relapsed, I've always forgot where my addiction has taken me. I get so far away from that miserable state, and that's when I begin to start relapsing again. So, I'm able to always have that picture in my mind and always, look back at it to see that that's always where addiction is going to lead me. There was a lot of hate when the overdose picture did come out and people, saying that I would never succeed. So when my 1 year rolled around, my 1 year of sobriety rolled around, I was, so excited to show people what I was like and what I am like now. I wanted to be able to give people hope that they can recover and show people that I could do it too.
Welcome back, folks. Today we have Dr. Bobby Smith with us, a renowned addiction psychiatrist who has recently performed some valuable research on opioid dependence. Lately, his team of colleagues have looked into the rate of relapse following discharge at a treatment center for detoxification. Dr. Smith, would you like to talk to us about your findings from this past study?
Yes, of course. Thank you for introducing me. As you mentioned, we have been investigating the rate of relapse of opioid addicts post-discharge. Following the discharge, we have interviewed 109 patients, and out of the 109 patients, 99 reported relapse. The initial relapse occurred within 1 week in 64 cases. Ultimately, lapse and relapse were seen as common among patients interviewed. Lapse is quickly followed by relapse in the majority of the cases.
After relapse, how many patients went back to the treatment center for care?
Treatment reentry rates were very satisfactory, with 92% of relapsers reassessing treatment, and the median gap of relapse to reentry was 4 months.
Wow. Given your results, would you change the detoxification process at these treatment centers to prevent relapses?
Personally, I would improve the aftercare for patients. After being discharged, if patients successfully found a comfortable community with people who have similar stories to them, then I would strongly think that there would be less people relapsing because of the support around them. Also, if the patient's families were educated on the treatment process, then they could be of good use in helping the person prevent any relapses.
This is very promising news. Thank you, Dr. Smith.
Thank you so much.